Hi, good evening everyone. Welcome to another FP Live by IILT. I'm hoping you are all doing great and have a happy new year this time. This is the first time I'm coming live in this year, so I hope everyone is doing really good, and I wish this year is going to be really successful for each and every one of you who is preparing for, who are preparing for the OET test as well. So in today's session, we will be dealing with sentence construction, which is quite a little bit of tedious task for most of the candidates because I've seen many students getting stuck as well as going blank while they are preparing sentences during the practice session. So today we are going to do this sentence construction all together, and as you guys already know, we have published in our brochure that we will be dealing with an end stage case, which is also another tricky area because most of the candidates get confused about how to handle such a patient, right? They might fail in providing emotional support and convincing the patient in the right way. Sometimes whatever we try to convince the patient might backfire as well, right? So no problem. In this session, we are going to deal with all such aspects, okay? So this is going to be a very much 100% interactive session because I'll be giving you live corrections, okay? You heard me right. I'll be showing you a cue card. So from the beginning itself, we'll be starting with it. And for the next 1 hour, we will be discussing the same thing very detailing, okay? We will be going through each task by task. I will give you time to look through the task and create sentences and make sure that you write down the sentences, okay? No matter how wrong it is or if you're making a lot of mistakes in that sentence also, no problem at all. This is your chance to get corrected as well as learn from your mistakes, okay? And by doing that, you will be helping others as well because those who are watching this also will get to know that there are different ways of sentence construction. So let's learn by sharing our knowledge with others as well. So we will do that in this session. So before that, there are many people joining. Nisha Worky, hello, hi Nisha, happy new year. All right, so we have an exam tomorrow, and if any one of you is attending the exam for tomorrow, all the very best. I hope it is going to be easy for you and you can crack this time, okay? Yes, so in today's session, as I mentioned, we will be dealing with the sentence construction, and as you guys already know that I have picked an end stage case as well, which is a common topic which you guys might be knowing. Okay, this is a patient who is undergoing dialysis 3 times a week, and he's totally tired, and he is being requesting himself to volunteer for the DNR, and the nurse has to talk to him, and you guys are very familiar with this topic, I know that. So the reason why I took this topic is because since you guys are familiar with it, it will be more easier for you to come up with the sentences. Means it won't be, you won't be so hesitant to do that too because something is familiar for you guys. And I want each one of you who are watching this, try to comment, okay? Try to type in your sentences and I will correct it, okay? No problem, even if it is wrong. And as I told you a little earlier, if you're making mistakes, they're also absolutely fine. This is your chance to learn and you're teaching others also, okay? This is wrong, this is the right way. So in a way, you will be learning by teaching others too, okay? So Shilpa, hi, good evening Shilpa, hope you're doing good. Alright, so I think we can directly start with the session because we have a lot to discuss today, and just now I will show you the case note on the screen. I hope it is visible for everyone. So I'll give you some time to go through it. Okay, you guys can have a quick run through it. You can see the setting, you can see the background information, and there are six tasks that you have to go through as well. So I'll give you some time to go through it, okay? Just make you familiarize with the entire scenario and then we will discuss about it, okay? And be ready to type in your messages too, because this has to be an interactive session, and for the next entire 1 hour, I'm going to be there with you guys to learn it together, okay? So go through the case note. So you can see the setting, the background information, and each tasks one by one. Based on that, we will learn to create the sentences. Okay. I'll give you a quick minute more, so just try to understand what is being discussed here and try to get specific information. I don't want you to go in deep here. I just want you guys to get a specific information or just a general idea about what is being discussed in this entire setting so that we can create sentences, okay? All right, I hope you guys got enough time to go through that. So let's get started, okay? And I'm expecting cooperation from your side as well. So the very first thing you guys need to do when you get a case note is to try to understand where exactly the scenario is taking place, and to understand that you need to to go to the setting. So here the setting is given as hospital ward. So from that itself we understood this is a noun case, right? But in all cases, we cannot understand this, okay, except the hospital ward cases. Other than that, if we get any other setting, do not come to the conclusion it is a non case or an unknown case, okay. I say this in most of my lives because people go wrong there. They kind of like blindly jump into a conclusion that this is a non case or an unknown case just by seeing the setting. You can't do that, excluding the hospital ward. Hospital wards are obviously non cases. Other than that, the background information will give you more details about whether this is a non case or an unknown case. So in this case, since the setting is a hospital ward, then you do not have to worry about it. You can understand this is a noun case, okay? So let's look into the background information. You are a charge nurse working in the dialysis unit. One of the patient's health is steadily deteriorating. The patient is an inpatient on your dialysis unit, and you see he or she appears lonely and depressed. Okay, the patient requires dialysis 3 times a week and is a candidate for renal transplant. So you got some information from that area, right? So let's see. In this case, since you understood that this is a noun case, the first thing you have to do is you have to ask the interlocutor, how may I address you during the role play? Okay, so it's, say for example, we can address this patient as Mr. Michael. Okay, so we got some information here. You are a charge nurse, so make sure that when you are introducing yourself, you say that you are a charge nurse. Don't say that you're a registered nurse there, okay, because your designation is being mentioned here very clearly. Sometimes it can be duty nurse, sometimes a charge nurse, sometimes a triage nurse. So make sure whatever it is, you speak that, okay. If the designation is not mentioned, then you can just directly go for the registered nurse part, okay. So you got to know your designation, your role, and then some information about the patient. It said that the patient's health is steadily deteriorating, okay, and the patient is an inpatient of the dialysis unit, so it's a very common patient for you. And the patient is appearing very lonely and depressed. The patient requires dialysis 3 times, okay. So 3 times a week dialysis itself will give you an information about how depressed the patient is going to be. So you understand the case. And it is also mentioned that the patient is ready for a renal transplant. So these are some information that you will get from this particular background detail. So from this and from the word and with the name of the patient, you can frame an introduction. Okay, so I'm giving you time for that. Now it's your turn to prepare an introduction. Okay, type in different introductions and we will discuss which is the best one here. Okay, go for it. If it is a noun case with all these details, how can you start your opening statement, or what is the best opening statement here? Go for it. You can type in it and let's discuss. So the patient's name is Mr. Michael, and you are walking in into Mr. Michael's room for something. So how will you start your conversation here? Yes. Do you really think that you have to introduce yourself, like give your name, your details, what is your role and everything, or you can just directly start with it? What do you think is the best introduction here? Alright, we have Anumol saying, hello Mr. Michael, I'm going to take care of you today. You can call me Anu. That is a good one, okay? That's a really good point, Anu. So, you really do not need to introduce yourself in a ward situation, but if you do also, that's fine. It's totally fine, okay? It's not mandatory. It's totally up to you. If you want to, go for it. If you don't, also that is fine in a ward case, okay? So here, as per Anu's sentence, she is saying, hello, Mr. Michael, I'm going to take care of you today. You can call me Anu, okay? That is a good and very simple statement, okay? Any other statements? Shilpa is saying, good evening, Mr. Michael. My name is Shilpa, one of the nurses here. I can see that you're a bit upset. Could you please explain what's bothering you? Okay, that is also a good sentence. Yes, I appreciate it. Any other sentences? Like normally, how would you be handling this? Like, I know that you guys come across such sentences or such scenarios very often. You might have done it already with your friends or with your colleagues. So just try to explain the sentence what you normally do, okay? Like the common way of your introduction in such cases. Alright, well in that case, I think we can discuss that right now. Okay, so I told you since it is a hospital ward, it is not very necessary for you to introduce yourself, but if you do also, that is fine, perfect. If you do, well and good. If not, if you feel like, you know, if you kind of like missed it out, also no problem, okay, don't worry. Because it is a ward, the patient might be knowing you, but if you can, well and good, okay. So here I am choosing to introduce myself here, okay. I feel like it's always good to start with your name when you are starting a conversation. So I'm going to introduce myself here as first. I'm going to say, good morning, Mr. Michael. My name is Richa. I'm the charge nurse on duty today. How are you feeling now? That is a very simple opening statement that you can do here, okay. The reason why I didn't ask him, you are looking really upset, okay, or what is bothering you, is because if you look into the tasks which is below, you can see that the patient is a little troublesome patient, okay. So initially itself, if I'm going to ask him what is troubling you, he might react in a bad way, okay. So that's the reason why I kept my opening statement a little simple. All right, so I think we are getting more sentences there. So Anita is saying, hi Michael, my name is Anita. I am charge nurse. I am the charge nurse. How are you doing today? Good sentence, okay, very simple and beautiful. Bindu is saying, good afternoon, Mr. Michael. My name is Bindu KB. I am the charge nurse to take care of you today. I am the charge nurse to take care of you today. I can see that you are a little bit depressed. Could you please tell me what is bothering you? Yes, that is also a good sentence, and I really appreciate your sentence construction, Bindu. That is a good one. Always keep in mind, have a very beautiful opening statement. None of these statements are bad, okay? Your sentences are really beautiful, but just make sure that you know the nature of the patient that you're dealing with as well. So from the entire tasks which is down, which we are going to deal with right now, we can see that the patient is not a very easygoing patient, right? So it would be better to have a smooth and simple start, and then later on we can catch up with it, okay? So that's with the opening statement. So we started like, good morning, Mr. Michael. My name is Richa. I'm the charge nurse on duty today. How are you feeling now? That's enough. Simple, elegant, and beautiful. Okay? So now let's look into tasks one by one. The first tasks. Check how he or she has been feeling lately. So we just did that, right? We asked him, how are you feeling now? So your first task is already done. Now let's look at your task number 2. When the patient is unresponsive, encourage him or her to talk about his or her fears. Okay, so this is what I told you, this patient is not going to be that easy to handle. So let's see how we can do it, okay? So Shilpa is asking, could you please tell your sentence once again? Yeah, sure. The sentence is nothing but it is, good morning, Mr. Michael. My name is Richa. I'm the charge nurse on duty today. How are you feeling now? Okay, or how have you been feeling lately, which is given in the question itself. Okay, how she or he has been feeling lately, so you can just use the same thing like how have you been feeling lately. All right, yes. So our next task says when the patient is unresponsive. When you see that itself, you can understand the patient is going to be really a troublesome patient. Okay, he's not responding, so you have to come up with a really good sentence which will make him talk to you. So how can you do that? And when you go to the next task, you have to keep in mind that you relate it to the previous conversation, which is very important, because maintaining the connection between the tasks is really significant when it comes to maintaining the conversation, right? So now let's check the complete order. We just introduced ourselves like in a good morning, and we greeted and everything, and we asked him how he has been feeling lately, and he didn't respond. So we are standing there. It's an awkward silence. The patient is not ready to talk to us. So from that point, you have to do a second task. That is, encourage him to talk about his fears. So how can you do that? Type in a sentence for it. Think of a brilliant sentence, or think of a very good convincing statement which will make him talk about his problems to you. Think about it. How can you handle the situation? The patient didn't respond, and for a patient who is not responsive, not responding to you, the patient is not really cooperative, how will you make him start talking? You really need to make sure that he's comfortable. You have to gain his trust. You have to build a good rapport with the patient and then start the patient talking, okay? So Nisha is saying, I can sense that you are quite upset. Please let me know. I'm ready to help you. That's a beautiful sentence, Nisha. I really liked it, okay? Just a few suggestions. I can sense that you're quite upset. It's a good point. Please let me know what is troubling you. Okay, please let me know what is troubling you. I'm ready to help you. Or you can say, I'm here to help you. Instead of saying, I'm ready to help you, you can say, I'm here to help you. Okay, but the sentence is really beautiful. I loved it. It's a good sentence. Any other sentence? Mr. Michael, and you're saying, Mr. Michael, I could sense that you are little bit nervous. May I know the reason so that I can help you? That is also very direct and a very effective statement. Good. Good. I'm actually liking the sentences. Steffi is saying, hi, Mr. Michael. You look so depressed and worried. Could you tell me the reason behind it? That's also a really good sentence, huh? Shilpa, Mr. Michael, if you talk about your feelings, then only we can help you. Okay, Shilpa, that's a very good sentence without any errors, but just a point of suggestion. Instead of saying, then only we can help you, it is a little bit blunt, okay? So it is like, if you want, let me know, then I can help you, okay? Instead of saying it like that, you can try in a little more different way to make him more comfortable and say something like, Mr. Michael, if you talk about your feelings, I'll be able to help you in a better way. That is a different sentence, okay? So then only we can help you. That means that if you don't talk, then we won't help you, okay? So don't try to sound a little, blunt like that there. You can try that in a little different way, okay? But the sentence construction was really good. Yes, Rishana Ryan, Michael, you seems to be worried. Is everything all right? Yes, that is also a good sentence. Just a small mistake that I would like to point out is that we do not say you seems, okay, it is seem. You seem to be worried. Is everything all right? Okay. We use seems when it is like we are pointing out to he, she, or it. When it is I, you, we, they, we don't use the S with the verb, okay, in the simple present tense. So just keep that in mind. It's not you seems, which is a common mistake everyone makes. Okay, I hear that every time. So always keep that in mind. It's not you seems, it is you seem to be a little worried. Okay. Yes. So I can see that you guys are coming up with really good sentences. Okay, some are very direct, some are really good constructed. So one more. Steffi saying, I can sense your feeling. Would you mind telling me the worries? I'm here to support you. really like the second half of the sentence, okay? Would you mind telling me the worries? Instead of saying the worries, we can say, would you mind telling me your worries? Or what is worrying you? I'm here to support you, okay? And instead of saying, I can sense your feeling, you can say that I can sense that you're overwhelmed. That's a really good sentence you can use there, okay? Yes, so I'm really happy to see that you guys have good emotional support while you're doing the rock face. So yes, good. So I'll give you another sentence which you can use here. So I told you that we introduced and then we asked him how he's feeling, okay, and he said he didn't respond really well and we want him to talk, okay. So what you can do is you can say a good sentence like, Mr. Michael, I understand you're going through a very difficult time. Mr. Michael, I understand you're going through a very difficult time, but I'm here to help you. So if you tell me what is worrying you, I can help you in a better way. So I'll just repeat that again. So you can say, Mr. Michael, I understand you're going through a very difficult time, but I'm here to help you. If you tell me what is worrying you, I will be able to help you in a better way. Okay? And don't stop there, because you just said a statement and you're just leaving a blank space after that. Okay, so you have to move to the next point. All right, so what you can do is you can say, so could you please tell me what is bothering you? Okay, add to that. Do not stop after saying a statement, because when you stop after saying a statement, it is going to leave a blank and it will leave the patient also confused, like, okay, should I be okay with now, or should I be, responsive here? So the patient will also be a little bit confused. So always make sure that when you complete saying a statement, add a question there, okay? So would you please tell me what is bothering you? Okay, so that is how you can do your task number 2. I hope that is clear for everyone. So let's look into task number 3. Calm the patient and explain about dialysis and its importance. End-stage kidney failure, dysfunction of kidney, dialysis keeps the body in balance. Okay, so now we just made him talk. So say for example, he said that that I am an end-stage renal patient and I have to undergo dialysis 3 times a week and I don't understand why. It is very painful, very expensive. I feel like I'm a burden for my family and I don't want to live like this. I don't understand why I have to undergo 3 times dialysis in a week. This is a response of Mr. Michael. Give me a sentence to convey task number 3. Think and type it down and let's discuss. Don't forget to acknowledge. Always make sure that you acknowledge, okay? It is very important. Okay, so Anu say, Mr. Michael, I do really understand your concerns, but please try not to worry. I can say that this is the best and possible treatment for you right now. I hope you're totally aware about your condition. Am I right? I appreciate your sentence construction, Anumol. It is really good. However, I think it can be a little more sensitive because you're talking to an end-stage patient here. So, Mr. Michael, I do really understand your concerns. It's a good point. And you said, but please try not to worry. Okay, that is fine. Your acknowledgement is a normal one. That is okay. I can say that this is the best and possible treatment for you right now. Okay, so instead of saying I can say that, you can say I'm afraid this is the best and possible or best and effective treatment for you right now. Okay, because the reason why we are using I'm afraid is because there is nothing else, right? So the patient is also asking you, like, is this the only way? Like, why I have to take dialysis 3 times a week? The patient is also upset about it, right? So what you can say is, I'm afraid this is the best and effective way for you. Okay, I hope you're totally aware about your condition. So then again, you don't have to use am I right, because we're already saying I hope you're totally aware about your condition. Then you can say isn't it? Okay, so that will be a little more simplified format there, but your sentence construction was really, really beautiful. I liked it. Yes, any other way of saying it? Yes, you can type in and then we'll discuss, and it's your chance to get the live corrections and learn from the mistakes, as well as others can also learn from it. And I'm very happy that you guys are coming up with really good sentences, okay? I'm so happy to see the sentence construction, which is really beautiful. Yes, as Anu said, that's a really good way. She acknowledged first and then she explained that this is the only possible treatment right now. And then she asked him that, don't you know about your condition, in a very good way. Okay, so any other sentences? You can even try explaining about kidney failure in a small manner, in a light manner, not in a very complicated. Don't use any sort of medical jargons there, but still you can try to come up with a simplified way of explaining why dialysis has been advised. Okay, so think of it, type in, and we will correct it. All right. All right then. So I think I'll give you a sentence right now. Okay, Shilpa is saying, Mr. Michael, I understand how troublesome it is for you to undergo dialysis 3 times a week. Really beautiful statement. I love the first one. But dialysis is the possible and only way for you right now, okay? Slight sentence construction mistake. However, you can, instead of saying but, try to use however. However, I'm afraid dialysis is the only possible treatment for you right now. Okay, but the first part is amazing. Really good, Shilpa. Then, yes, Epsi is a, Mr. Michael, you seem so worried. May I know the reason behind it? Okay, so that was the first part, I guess. Rishan is saying, all right, I understand your feelings. Don't worry, you are in the right place. Dialysis is better treatment for you. Okay, Rishana, the sentences are clear, but still you're dealing with a very sensitive person here. The patient is end stage and he is emotionally very weak. So it would be better if we can support him in a little more of empathetical manner, okay? Because rather than doing the tasks, what they are, the OET, they are looking at is your ability to communicate in a better way, okay? So you need to try to understand the mental state of the patient as well, okay? So you need to be a little more supportive there. The sentences are good, but very simple ones. Just try to make sure that you are sounding a little more supportive there, okay? Alright guys, so let's see a good sentence that you can use here, okay? So what you can say is, you can say, Mr. Michael, I understand you're distressed. Mr. Michael, I understand that you're distressed. If you want, you can add by saying, I understand that you're emotionally distressed right now. However, I'm afraid dialysis is the only way to keep you alive right now. If you want, you can say like that. Or if you want to, lighten it in a little way, instead of telling him, it is the only way to keep you alive, if you want to bring it down in a little bit, light manner, you can even say, it is the best treatment option available for you right now, okay? So starting from the beginning, I'll just remind it for you. So Mr. Michael, I understand that you're emotionally distressed. However, I'm afraid dialysis is the best and effective treatment option available for you right now. The reason why the doctor advised dialysis 3 times a week for you is that because your kidney is not strong enough to function properly, okay? So in order to, through this dialysis, we will be stabilizing your body. Okay, so if you want, you can explain a little bit like that. You do not have to explain everything like the entire medical details there. You can just say something like, your kidney is not functioning properly, so that the waste won't be getting flushed out of your body properly. So this dialysis is helping you through to maintain the balance of your body. So that part is explained in your case note as well. If you can look in the case note, in the bracket it is mentioned the patient is having end stage kidney failure, dysfunction of kidney, and dialysis is keeping the body in balance. Okay, so that is a really good point that you can connect. So an altogether complete sentence, what you can say is, Mr. David, I understand that you're emotionally distressed at the moment. However, I'm afraid doing dialysis is the best treatment option available for you right now. The reason why doctor advised dialysis is because you are having an end-stage kidney failure. That's the reason is because your kidney is not functioning properly. So dialysis will keep the body in balance. Okay, so or dialysis will help to keep the balance of your body. Okay, so that is something that you can explain, and by keeping the balance in body, what they have meant is the proper functioning of the kidney. Okay, so always make sure that once you complete the explanation of a diagnosis, you have to ask whether the patient understood it. So you have to check the understanding of the patient. So here you can ask a question like, I hope that's clear for you. Okay, so that's how you're going to finish task number 3. I hope that is clear for everyone. So to this, the patient is going to tell you, no, I don't want to. It is very painful. It is very expensive, and I feel like I'm a burden for my family, and I'm nowhere to be seen on the list for transplantation. I'm not going to get a donor anytime soon. So I am not feeling good about it, okay, or I'm not feeling happy about all this, so I would like to nominate myself for do not resuscitate. Okay, so what is your response to that? That is task number 4. When the patient is hopeless, encourage him, donor will be found soon. Okay, so how can you console the patient here? It's your turn to create sentences, and let's see what type of sentences we are getting. Go for it. This is a little bit tricky area, okay, because the patient just said the patient doesn't want to continue, doesn't want to be saved if the patient is having any sort of cardiac arrest, or if the patient is crashing, he wants to, he wants to just die. Okay, so how will you respond there? If you want, you can look in the next task as well, okay, because something is similar. Suggest consulting a counselor when the patient speaks about DNR. Okay, so if you want, you can do task number 4 and 5 together, because both of those tasks are somewhat similar. Yes, think of some sentences there. This has to be a little interesting, okay, because normally whenever we do this role play, when I act as the patient and I say that I want DNR, I want to die with dignity, I have seen candidates telling me, okay, so Mr. David, we do have some procedures here, and then they're so happy to let me die. Okay, so never do that. You have to at least try once to, generate some sort of hope in the patient's mind. Okay, so create your sentences. Let's see, what will you do if your patient is telling you the patient does not want to be saved if the patient is crashing, the patient just want to die with dignity, and what will be your response? Okay, type in. Think of a really good acknowledgement statement, because it's very important that you always start with acknowledgement statements, okay? Because that is going to be really important, because by acknowledging, you are actually telling the patient that you understood what the patient is going through. So it is a really good way of showing how you feel for the patient in words. Okay, so acknowledgement is very important whenever the patient raises any concern. Okay, yes, I'm waiting for the sentences. Think of it. What will you do when the patient asks for DNR? And I'm pretty sure that you might have seen, or you might have dealt with such cases. May not be in your real life, but I'm very sure that you guys might have done it while you're practicing or preparing for it. So think of something. Yes, Mr. Michael said he doesn't want, he is nowhere to be seen on the transplantation list, and he wants to nominate himself to be a candidate for DNR. So Nisha said, Mr. Michael, I can sense your feelings. Please be positive. Definitely we will find a donor for you. Good sentence. It is definitely we will find a donor for you. Okay, just a slight mistake there. And again, Nisha, that is a good sentence construction, but it could have been a little more better. Okay, try thinking of little more, try to think a little more in an emotional way there. Emotional as in not to be very emotional, but little more empathetic as well as supportive, kind of like an encouragement. You have to make him feel better. Okay, yes. All right, yes. So what you can, yeah, Shilpa, Mr. Michael, I perfectly understand you're very vulnerable and in pain right now. Good sentence. And want to undergo DNR. However, I would like to tell you to acknowledge your decision once again. Beautiful. If you want, I can arrange a consultation with the counselor who will be able to guide you in a right direction. Okay, so you don't have to write that better there, I guess. Who will be able to guide you in the right direction. Beautiful statement, Shilpa. That is amazing. Okay, I really liked it. Shilpa, another sentence. Don't worry, we are trying to find a donor for you and hope that we'll find very soon. Okay, good. Again, this is saying, don't be disappointed, Mr. Michael. I can understand your feeling. You are in the treatment, in the transplant list. Hope for the best. Until that time, we can manage your condition. With this effect, dialysis, don't lose your hope. Good. Really good sentences, guys. I liked it. Anu saying, Michael, please don't be hopeless. I know that you have been waiting for a donor, but I can assure you that you will find the right one very soon. Meanwhile, we will continue with the dialysis till we find a donor. Good again. Yes. So really good sentences, guys. I liked your sentence construction and I can see that you're using really nice terms there as well. Okay. So what you guys can do here is that you guys can try a paraphrasing method. A paraphrasing method is nothing but you are actually using the information that was told to you by the patient himself or herself back to the patient. Okay. So just recollect the information whatever Mr. Michael told you. Mr. Michael told you that he's doing dialysis 3 times a week. It is very expensive. He feels like he's a burden for the family. He's in a lot of pain. These are the reasons of what led him to decide to, nominate himself for a DNR, right? Try to recollect these points and try to acknowledge him using these points. Okay, that is the best way you can avail here to connect more with the patient, because you guys know that relationship building is very important, right? Although when it comes to the examination, it is under the clinical communication criteria and has 3 marks, but still, if you are able to maintain a good relation with the patient, it is going to be a beautiful conversation and that will definitely boost your score in a really good way. Okay, so you have to try that. So we have one more statement from Steffi. I appreciate your concerns. If I were in your position, I would feel the same way. Please don't lose your hope. We're trying our best to find a donor for you. Good. Very professional. I like that too. Okay, so I think it's time that we see a sentence now. Okay. So what you can do is you can actually start with an emotionally supportive statement. You can say something like, Mr. Michael, I know it is emotionally daunting for you. Okay, Mr. Michael, I know it is emotionally daunting for you. Then what you have to do is you have to paraphrase information what you know about Mr. Michael. So what did Mr. Michael told you? He said, from your perspective, I understand that you are undergoing dialysis 3 times a week, which is expensive, painful, and you feel like you are being a burden for your family. I totally understand you. But please look back. You have come so far, and you are there in the transplantation list as well. So there is still hope. So please don't give up right now. Moreover, if you would like, I can arrange a consultation with a counselor, so he will be better, he will be useful for you to give you better suggestions. So this is another way of talking to Mr. Michael here, okay? So let's go back and say that statement. I'm not sure whether I'll be able to tell you the exact same words because I was being spontaneous there, but still let's see, okay? So the task is when the patient is helpless, encourage him. Okay. So what you can say is you can say, Mr. Michael, I can see that I understand it is emotionally daunting for you. And from what you told me, I know that you're undergoing dialysis 3 times a week, and you think it is, it is time consuming as well as it is expensive for you, and also it is very painful from what you have said. But please look back, you have come so far, so please don't give up right now. And also we are looking for a donor for you, and yes, there are some improvements, so we can expect for the best. Moreover, if you would like to talk to someone, I can arrange a meeting with the counselor so that he can help you in a better way. So what do you say? Okay, in a better way. So what do you say? All right. So Shilpa is asking, can we use moreover? Yes, Shilpa, this is speaking, so you can use your connectors here, no problem, okay? So unlike the OET writing, there is no problem in using connectors in speaking, no problem, go ahead. Okay, so GT is saying, I can understand you, Mr. Michael. If I were you, I would feel the same way, but I hope that we get a donor very soon. Very promising statement, GT, nice, good. All right, so that was a statement which I said. Okay, so whenever your patient is asking for DNR, just try to encourage him by saying that he has come so far. Okay, so the patient did something. All right, like the patient was fighting himself and he came so far, so don't give up right now. So when you are being optimistic like that there, you're making the patient feel a little more better. So whenever you're dealing with DNR, try to use this usage. Please look back, you have come so far, please don't give up now. Okay, just a very simple statement. Mr. Michael, please look back, you have come so far, please don't give up right now. Okay, that is a really good statement that you can use right now. All right, so that is how we are going to say. And here I also added task number 5 with it because both of it looks kind of like similar to me, because task number 4 is encouragement. Task number 5 is also a way of encouraging the patient to meet the counselor for a better decision, right? So at the end, to finish that particular task, what I can say is, so what do you say? That what do you say is asking him or her, him, whether he's interested to see the counselor. Okay, what do you say? So the patient is telling you, no, I don't want to. I have made up my mind. This is my decision. So I don't want to. So how will you respond to that? That is your last task. So how will you do it? Please go through that and create sentences. Yes, you have reached the last task. The patient said, regardless of your explanations, the patient is still sticking on to his decision. He wants to have a DNR. So what will be your decision, or how will you respond to it? Not your decision, how will you respond to it? Yes, think of a really good sentence. So how can you encourage a patient who is very stubborn? Because the last task is telling you to explain the procedures, right? So how can you do that? Okay, Shilpa is saying, Mr. Michael, if you're really considering the DNR, in that case, I respect your decision. I really like the way you're saying if you are really considering the DNR. Okay, in that case, I respect your decision is a good way of saying that. Yes. So this is a pretty easy task because there is nothing much for you to explain. What you need to do is you need to tell the patient about the hospital policy, and the hospital policy will not be nothing much. It will be a written document, like a written consent, and then he or she will have to discuss it with the doctor, because you are the nurse, right? So you'll have to inform the doctor about it. That's it, nothing much about it. And then you can tell Mr. Michael that you will get back to him. So how can you put that in a sentence? So make sure that whenever you create a new sentence, you have to always relate it to the previous sentence because your conversation is going on, right? Whenever you build the sentences, you have to make sure that you're connecting there, okay? So Shilpa is saying, I would like to explain the hospital policy, which says that your family members should be present at the time of the procedure, and also you will require to sign a consent form as a legal case. Okay, wow, that is a pretty lengthy one. And you mentioned everything. So yes, this is a correct strategy, Shilpa. Yes, that is it. Good sentence. But my point of advice or my suggestion, you can keep it very simple there, okay? So what you can say is, you can say something like, well, in that case, Mr. Michael, as our patient, we do respect your decision. So if that's what you want, I will tell you the hospital policy, what we have to follow for a DNR. So we would require your written consent, and we'll have to inform your family members as well. And then I'll inform our concerned doctor, okay? And then we will get back to you, okay? So this is the statement that you have to explain. All right, so these are the points that you have to say here. Then make sure once you say this also, you actually try to, make the patient rethink about it. Not forcefully, but still you leave a track there, kind of like leave a trace. You can say something like, in the meantime, I hope that you will reconsider it. Something like that, okay? So you can ask, before you wind up, you can ask, like, so is there anything else? So she's going to say, or he's going to say, oh, no, nothing else, that's it. So you can say, well, then I'll inform the doctor about your decision. So you can take rest. In the meantime, I hope you will reconsider your decision as well, okay? So Animal is saying, all right, Mr. Michael, first of all, I would like to tell you that we can wait for the donor, as well as I'll arrange the counselor so that he can support you to come out of your thinking, which you have right now. Still, if you still go ahead with your decision, I'll explain you regarding the hospital policy. Good sentence with a little bit of grammatical mistakes here and there, but that's fine, I guess. I really liked your sentence, okay? So you're saying, all right, Mr. Michael, first of all, I would like to tell you that. So instead of saying, first of all, I would like to tell you that, you can say, well, in that case, okay? All right, Mr. Michael, well, in that case, I would like to tell you that we can wait for the donor, as well as I will arrange the counselor so that he can support you to come out of your thinking, okay? So he can support you to make a good decision. That's fine. Come out of your thinking is not a very right way of saying it. You can say he will help you, he can help you to make a good decision. Even after that, if you wish to go ahead with your decision, I can explain you. Instead of saying I will explain you, you can say I can explain you regarding the hospital policy. All right, so that's a good way too. Yes, I liked it. So Steffi is saying, Mr. Michael, I respect your wish. If you're willing, I can arrange a counselor to talk the policy of DNR. Would that be okay? Okay, actually we are not suggesting the counselor to talk about the DNR. We are actually suggesting the counselor to talk about the decision he made. Okay, when the patient speaks about DNR, that means that we are actually trying to talk him out of the decision that he made about DNR. Okay, so explanation about the DNR is actually a last task. So Steffi, can you please look into the last task, explain the hospital policy for DNR to the patient, that particular area. Okay, so what you can do is, after explaining the fifth one, so if you remember the fifth task, we finished by saying what you say. So he's saying that, no, I already made up my mind, I don't want to, I'm not ready to continue with it. So I don't want to have this pain and trouble, and have all this trouble like this. So I have made up my mind. So you're saying, all right, Mr. Michael, well, in that case, as our patient, we do respect your decision, okay? So if you have decided to go ahead with DNR, we do have some hospital policies that you need to consider. So we'll require your written consent, and we'll have to inform your family members, or your nearby, your close family, and as well as we'll talk to your concerned doctor. So is there anything else you want me to do for you? Okay, so that is how you can finalize this entire conversation. So Bini Shwagis is saying, yes, Mr. Michael, I respect your decision. So I would like to explain regarding the policy and procedure of DNR. Great and simple sentence. I liked it, Binish. Really good. Good going. That's a good sentence. Okay. So if you guys have any other sentences that you guys need to be, need to know whether it is the right one or not, you can type in right now. And then let's see a good conclusion for this particular cue card. Okay. So we just handled Mr. Michael in a really good way. We tried to console him, we tried to encourage him, but he was not happy. He was not ready to go forward with what we are suggesting. So he made up his mind, and then we actually said, okay, fine, then if that's what you want, we also respect your decision, and we wind our conversation there. So how can you complete the entire conversation and say bye-bye to Mr. Michael here? Think of a good conclusion. Shilpa is asking for the sentence. You mean the DNR sentence? So DNR sentence is nothing but you can say, well, all right, Mr. Michael, well, if that's what you want, as a patient, we do respect your decision. So if you have decided to go ahead with DNR, there are few procedures that you need to consider. Okay, we would require your written consent, and we also would like to talk to your family members. Okay, then the concerned doctor will also come and meet you. All right, something like that, and that's how you can finish it. All right, so Vijesh is saying, I completely respect your decision, Mr. Michael. Let me explain the policy and procedure of DNR. Good statement, Vijesh. Just an addition that you have to make is, Mr. Michael, I completely respect your decision. Okay. In that case, let me explain the policy and procedure of DNR. Okay, so if you want, you can also say that since you have decided to go ahead. Okay, that's a good statement you can use there. Since you have decided to go ahead. Okay, that's a good one. Go for it. But the sentence is really good. This is saying, Mr. Michael, I respect your decision. I can inform your doctor about your decision, and I can arrange a counselor for you. After that, we can inform your family about your decision. Meanwhile, you can reconsider about your decision. This, I really appreciate the sentence, okay? There are a lot of decision though. Too many decision, and that will be a repetition. So you have to reduce the number of decisions that you have repeated, okay? So if we go line by line in that, you can say, Mr. Michael, I totally respect your decision. Well, since you have decided to go ahead with this, I will inform the doctor and arrange a counselor for you. Also, I would like to talk to your family about it. Meanwhile, please try to reconsider it. Okay, that's enough. Okay, I just pick the main points from the entire sentence, and that's how you can finalize the statement. Okay, because if you see that the term decision is repeated a lot of times, and that will be kind of like a very prominent repetition, so try to avoid that. Okay, but the sentence was really good. I liked it. Okay, yes. So any other sentences that you guys would like to get corrected about the DNR part? If so, you guys have a few more minutes. You can type in and get corrected. Okay, always make sure that you relate to the previous conversation to maintain the connectivity, and whenever the patient arises the concern, always make sure that you start with an acknowledgement, and then you start explaining the task and wind that particular task in a proper way. So by that we have completed all the tasks there. So let's look into a proper conclusion, okay, because a conversation like this requires a beautiful conclusion as well. So let me know your conclusions. How can you conclude this in a very good way? Always make sure when you conclude, you relate to the context that you have been dealing with so far, because that is very important. Trust me, I have seen many people just finishing the entire conversation very bluntly, okay, just saying like, so thank you so much for your time, I'll take care, I'll talk to you later. Never end your conversation like that, okay? So think of a really good conclusion and let me know. So Shilpa is saying, well, Mr. Michael, thank you for your time. Now I'll inform your doctor about your decision. Meanwhile, please reconsider it once again. Okay, that's a good one. Okay, I liked it, Shilpa. That's a good point. So what you can do is, you can ask the patient, so is there anything else you want me to do for you? So Mr. Michael, is there anything else you want me to do for you? Okay, so he's saying, no, nothing else. All right, so you can say, thank you so much for your time and patience, Mr. Michael. I hope that you'll have I hope that you will be doing well in the future. So since you already made up your mind about the DNR, I'll inform the concerned authorities about it. And in the meantime, if you require something feel free to contact me or press the buzzer or something like that, okay? So always make sure you relate to the content, because the patient is in the ward, so we know that the patient is admitted there, right? So you can tell. So if you require something, please press the buzzer. I'll be there and I'll come and help you with it, okay? So just imagine that the conversation is taking place in this particular setting and you are there. So always conclude it like that, okay? So you are right now in the ward, you're talking to him by his bedside, and you're leaving from there, so he's still there, right? So you are leaving, you are going to the next room, so you can say that I'll be there, so if you require something, ring the buzzer, I'll come and help you, okay? Yes. So Vijesh, is there anything that you would like to ask me? I hope I have cleared all your doubts. I'll come back to you soon. Good, simple but beautiful statement. I liked it, okay? Yes, so I hope this was helpful for you guys. So just a recap of what we have discussed today. Always keep in mind that you actually create sentences by understanding what the requirement of the patient is, and if you feel stuck or if you feel like that your sentence construction is going really difficult, look into the case note itself, okay? Because sometimes you can, not sometimes, all the times you can create sentences from the very task itself. You can pick the keywords, you can connect it, and you can create sentences from there itself. Always keep in mind that you connect to the previous conversation, okay? When you complete task number 1 and you start task number 2, make sure that you start it from the end of task number 1. Likewise, when you start task number 3, make sure that you start it from the end of task number 2, because these are connected. Always make sure that your fresh conversation is going to be a connection, going to be connected to your previous conversation. That connectivity, that consistency has to be maintained, okay? And always keep in mind, whenever you start a task, do not directly jump into the task. Always acknowledge, provide reassurance, or provide empathy statements whenever required, because more than completing the task, your main thing is to show that you are a good communicator. You have the ability to understand what the patient is going through, and you understand the pain of the patient as well, okay? So just do not directly jump into the task and do not rush to complete everything. You also try to spend some time to emotionally support the patient, okay? And I have seen many students asking about moreover, however, furthermore, besides. So when it comes to OET speaking, you can use the connectors, okay? I can see that some people were getting confused about the usage of moreover. You can definitely use it, unlike OET writing, okay? But just keep in mind that you don't overuse it. If it becomes too much, then that is not a good sign. Always try to use very professional ones, okay? So if you use moreover for one time, that's fine, totally fine, okay? You don't have to worry about it. All right, so I hope this session was helpful for you guys. I'll see you guys next time with another topic, and let me know your suggestions and feedback, okay? You can post your valuable comments and suggestions in the comment section, and I will definitely go through that, okay? So I'll see you guys next time. Until then, take care. Bye-bye. Good night.